Hello everyone, my name is Mwanamvua Boga. I'm a nurse manager and a trainer on health communication and emotional competence for health workers in Kenya. I train health workers on how to communicate respectfully with patients and how to manage the many emotional challenges that they face in their workplace. So we all know how it feels to be respected. It feels so good and it feels so wonderful. But we also know how it feels to be disrespected. It's very hurting and it can be very dehumanizing to be disrespected. So respect is a core value in the medical and nursing profession. And respect enables us to build trust with patients and to build professional relationships with patients. And when patients are respected, they feel good, they feel valued, they feel safe to open up their innermost concerns. And this enables us as health workers to really emotionally connect with them and offer care that is humane and care that is very respectful. But however, we know that disrespectful care is very common globally in the healthcare system. There are reports in Kenya of how mothers face abuse when they go to deliver. And I know most of you may be aware about the Francis report of how patients face disrespectful care in the NHS in the UK. So the question we're asking ourselves is, why do health workers disrespect patients at a time when patients are so vulnerable, when they need to be shown kindness and care? So there are so many reasons why these behaviors happen, and one of the main reasons is that health workers work under very stressful situations. They were dealing with death day in, day out, handling very difficult situations, dealing with our own emotions, our own fears and frustrations. So all this can really influence the way we communicate with our patients. And emotional labor, it's not taught in our medical and nursing curriculum. We do not have the skills to really manage these situations. And also there are other reasons why health workers disrespect patients, and mainly the national and medical hierarchical systems where respect is shown upwards. So we expect patients to show us respect and not vice versa. And also the lack of consequences of disrespectful behaviors among health workers. So we disrespect patients and we walk scot-free in this behavior. So it kind of continues because we are not punished for it. So the question we're asking ourselves is, how do we train health workers to manage these emotional challenging situations for them to be able to offer care that is respectful? And this is the training that we run in Kenya to equip health workers with these necessary skills. And the training we use is called the iCare Haaland training model. And it's a training model that was developed by Anna Haaland, who is a social scientist from the University of Oslo. And she has developed this training with users, with nurses and doctors in different contexts in Eastern Europe and in Africa. So the training aims at addressing health workers' communication challenges at the workplace. And it's a process training over 9 months. And why 9 months? Because we are targeting attitude and behavior change. And we cannot quick fix bad behaviors or bad attitudes. We need time to do that. So the training is 9 months, and it has phases of self-observation and reflection at the workplace using guided reflective assignments. And then we build in experiential learning workshop where the health workers learn these skills to care. So how does the process work? So the main approach we use in the training is the self-observation and reflection at the workplace, real-time with patients, using guided reflective assignments. So we give the participants an opportunity to reflect on their own communication behaviors with patients. And they get to see, when they treat patients well with respect, what that means to care for the patient. And they also get to see how disrespecting a patient feels. And they see their behaviors real time, and they see that when they disrespect patients, patients feel hurt, they close up, and they're not able to share their concerns. So when health workers see the effects of their disrespectful behaviors, they discover the need to want to change. They feel that this is not the way I want to treat my patients, and they discover the need to want to change. And this really rekindles their motivation to offer care, to offer better care to patients. So this is the process that we use in our training. So what results are we seeing using this process? So across the 9 countries where this training model has been implemented, we have seen a reported increase on patient providers' ability to offer respectful care. They're also reporting increased awareness on how they respect patients, and also they are reporting increased awareness on the ability to recognize their own emotions, patients' emotions, take a step back and control their emotions, to take responsibility, to communicate well. And once they are able to do this, they say that it really helps them to manage stress and burnout. So they report increased job satisfaction. So these are key changes that we are seeing using this model. And just to focus on the aspect of respect, what we realize that, especially for the training in Kenya, at baseline, most of the participants were not aware of the need to show respect for patients. They felt that it's the patient to show respect to them and not the other way around. But throughout the training process, they recognize their own power position as health providers and how that influences the way they relate with patients. And they're also able to see the effects of not showing respect to patients. So by the end of the training, most of them actually changed their perception on how to treat patients as fellow human beings. So most of them, they acknowledge that they're now treating patients better than before, and they're able to handle the many emotional challenges that they face. And one example of such kind of a change is an example where one of the health workers reported that how she handled the mother differently from before. And this is an example where she said the mother did not know what to do and started breastfeeding her baby, who was very sick in distress. And she removed the baby from the oxygen. I almost yelled at her because the baby had gone into apnea. I became aware of wanting to react and stopped myself. I gently asked the mother to hand over the baby to me. I resuscitated, and afterwards I explained to her about the baby's condition. Previously, I could have yelled. So these are some of the changes that the health workers are reporting in terms of how to handle their own emotions. And another example that they're also sharing is, when I treat patients with respect, I stay stable. I have noticed that when I treat patients with respect, they are easier to handle and are less fussy. They seem to gain trust and confidence in me. And when I treat patients with respect, I stay stable and strong. So these are some of the key changes that the health workers are reporting using this training approach. So in summary, we are saying abuse and disrespect is very common in the healthcare system, where there is need to empower health workers with the necessary skills to manage the many emotional challenges that they are facing at their workplace, to become aware and treat patients in a manner that is respectful. And these skills are currently not taught in the nursing and medical curriculum. So there is need to really teach health workers these skills. And we have seen from our training model that it's possible to train health workers on these skills using experiential learning and reflective practice. So we are saying that when health workers show respect to patients, it influences the quality of care they give, but also it also influences their own, it improves their own well-being and job satisfaction. So our recommendation is that the nursing and medical curricula need to really focus on training health workers on emotional competence in their nursing and medical curricula. Thank you.